Good morning. Today we are going to discuss a topic that is very important to female health, cervical cancer screening. Cervical cancer is a cancer of the cervix that can be caused by the human papillomavirus, or HPV. This is a sexually transmitted infection, but even if you are not sexually active, the current guidelines recommend that you begin getting a pap smear at age 21. Now, what is a pap smear? This is a procedure in which your physician will insert a wooden or plastic spatula into the vagina and brush the cervix in order to obtain samples of the cells to be examined under the microscope. This should be a relatively painless procedure, and the whole point is to catch any abnormal changes of the cervix before they turn into cancer. Between the ages of 21 and 29, you should get a pap smear every 3 years, and then, beginning at the age of 30, you can also add an HPV test to your pap smear. When you get a pap smear and HPV test at the same time, this is called co-testing. The main benefit of co-testing is that you will only need to get tested every 5 years. Basically, you are lengthening the time of testing. Please keep in mind that this is the screening schedule if all of your results are normal. If there are any abnormal results, then you may need to be screened more often. You can stop getting both pap smears and HPV tests once you turn 65, but that is only if your HPV tests for the past 15 years have been negative. If you did have a recent positive HPV test, then you should continue getting tested until you are 70. If you had a hysterectomy at any point in your life and they also removed your cervix, then you no longer need any screening tests as long as you have never had an abnormal test in the past. Now I would like to give you some information on how important cervical cancer screening is. Among women diagnosed with invasive cervical cancer, 1/2 have never had a pap test. In the US, we started pap tests in the 1950s, and by the 1970s, the incidence of cervical cancer decreased by 70%. To prevent HPV infections, which cause cervical cancer, you can also get a series of vaccines. This is given to both males and females between the ages of 9 and 26. The current recommendations from the Center for Disease Control is that boys and girls begin to get the HPV vaccine at age 11 or 12. If you have a history of smoking, HIV, or are taking chronic immunosuppression drugs for a systemic disease or organ transplant, then your screening guidelines are different, and you should consult your local healthcare provider for more information.